everyone. My name is Ivana Schnur. I am the Chief Medical Officer and co-founder of Sensely, a company from San Francisco that specializes in virtual assistants for triage and chronic care. And it is my extreme pleasure to moderate this next session that is going to bring together for you virtual assistants, robots, and virtual reality. And since I know that this is the only thing that is standing between you and the beautiful sunset, I promise to try to make it as enjoyable and as possible. So let's look at what is ahead of us. And I am really trying here. I am having a hard time with this. Let's see. As you can see, this is a very popular graphic since we saw it in several of the presentations. And what we will be concentrating first will be the area of virtual assistants. And as you can see, AI exploded in pretty much every corner of the healthcare. But it is the virtual assistants that I am going to be talking, and we're going to start this session off with. What is really interesting to see is that we didn't really start with a huge success in the beginning. I don't know how many of you remember Clippy from Microsoft, but it really was quite annoying and irritating, a little personality that kind of popped into existence the least time you expected it, and you couldn't get rid of it fast enough. But we came a really long way. Even Siri, when she started in 2011, was really difficult to use, particularly for someone like me that has a little bit of an accent, and she just wasn't really responding and talking to me at all. But a lot changed with the arrival of Alexa. Alexa really brought a personality and huge change into a virtual assistant. And that is extremely important to us in healthcare, and let's look at why. One of the reasons would be, if you look at the New Scientist report, Alexa has about 100,000 people every day that call and tell us her good morning. There is about 500,000 people that profess their love to Alexa, and she received 250,000 marriage proposals so far. And you can laugh and think that this is really cute, but this is really one of the reasons that is going to change the way we use voice recognition, voice analysis, and how we're going to integrate it into virtual assistants. Because as Rosalind Picard in 1997, the MIT professor, pointed out, it is going to be this emotional range that we will add to our robots and chatbots that is really going to push them forward. And with the birth of companies like Sensei Analytics that basically help companies that want to include this technology to parse out the volume, the syntax, the meaning of what is being said, and then help them analyze and determine where is the listener. Where is the point where you are about to blow and toss your phone across the room because you do not want to talk to robot anymore. That is really something that is crucial if we are to move the robots into a place where they're going to be truly helpful in gathering medical information and medical data that is going to be relevant for us to create diagnoses, to actually help patients move from one place to another and determine where they need to go with their query of ailment or medical information. And so when we look at the Princeton Eugene chatbot that supposedly passed the Turing test and was in the simulation passed for a human, it would probably be hard to think about it without that emotional human factor. Because it is that is going to help us address and include these virtual assistants into a clinical process to address the crisis that we are continue to face. With one licensed physician for every 370 people in the US, no wonder that we are spending increasing amount of funds to bring into IT and communication to address some of these small tasks. And so Sensley has two virtual assistants, Olivia and Molly. Olivia in the UK is addressing these sort of low-value tasks of managing prescriptions, appointment bookings, and really signposting patients. And now we are embarking on clinical triage. None of this would be possible without her being personable, being able to really understand what it is that you are saying, what is the meaning, and where is it that you need to get to, and how to get you there. As you can see by this statistic, the consumers are clearly demanding that some of these tasks are being offloaded on virtual assistants. But even virtual assistants actually went through quite an evolutionary process. 50 years ago, the first one was Eliza, which was really just an intelligent way of manipulating conversation. So if I tell you that I'm feeling depressed, the computer would basically parrot back to me that I have depression and how do I feel about it. But it was the first start of a chatbot. We proceeded to companies like YourMD, where you just take a simple chatbot interface. Then comes applications like Florence, where you see sort of a rudimentary avatar for an elderly people and their medication reconciliation program. Why? Because it's so much easier for them to actually relate to the application if there is at least a picture of a human on it. To something like Ask NHS, where you have Olivia, fully avatar-based nurse that speaks and reacts back to you. You can always revert to the chatbot, but I thought that it would be really good to understand and see how Olivia is helping these to manage these major challenges that the NHS doctors are facing. And so I thought that it would be good to say hello to her and see how she is doing, so you get an idea.
Good afternoon, Ivana. And hello, AI Med.
Hello, Molly. How are you doing?
Oh my goodness. I know you wanted me to show off for this group, but you didn't tell me how many important people would be here. I am really nervous now.
Oh, I don't think you have anything to worry about, Molly, so let's get to it.
Okay, I'll do my best. At least Dr. Cheng isn't here. If he were, I would really be nervous.
I don't think you have anything to worry about since he is a big fan. So let's talk about what we are doing, really.
Okay, I can do this, but Ivana, you sound a bit tired yourself. Are you feeling okay?
Well, I may be coming down as a little bit of a cold, but thank you for noticing.
Oh my, I also see that from your daily check-in. You have not been getting enough sleep.
Yes, well, who does?
Well, I can give you some suggestions for some over-the-counter medication that you probably won't follow. Isn't that right, Dr. Schnur?
Oh, well, thank you. How can you say that, Molly? I do almost everything that you say.
Good. Then also remember to drink plenty of fluids, wash your hands, and please get some sleep tonight.
Yes, ma'am.
Good luck with the rest of your presentation. Goodbye for now.
Thank you, Molly. And, well, thank you, Molly. Appreciates that. So, 2 years ago, when we were thinking about healthcare messaging and being able to interact with a patient, we thought that this was too far, that we wouldn't be able to do it. But the technology is moving really, really fast. And so now we are able to actually interact with a patient, find out what their symptoms are, and signpost them either to a callback from a real clinician, to self-care, or sending them to emergency room and a hospital. We have deployed in West Midlands and service an area that is about 5 million people, and we do a triage. We do almost 1,000 triages a week. And so that future that we saw was so far is actually really quite here. And so from last presentation, we did talk about some of the ethical issues, and we do have a lot of the warning voices, be it from Professor Borstrom or Stephen Hawking or Elon Musk. But we do have to ask ourselves, where is this information going to be going? Because we are going to be telling our AI virtual medical assistants a lot of information about us. We're going to be sharing far more than we are usually sharing with our doctors and nurses, because talking to Molly is far easier, and she gets out of me far more than I would be willing to talk to my doctor. And so even though I think AI is a tremendous opportunity, and it is likened to another industrial revolution, it is really encouraging to have a partnership for AI in the Silicon Valley, and meetings like this where we can actually take these issues, discuss them, and confront them with what is in the field right now and where the technology need to be going, and what questions and answers we have to be asking and answering in order to move this field forward. Fran? Thank you.
Good afternoon, everyone. I think my slides will be coming up in just a second here. I'm Fran Ayala-Somayajula. Wrong one. That's fun. Thank you. I'm Fran Ayala-Somayajula from Global Healthcare at HP. It's a pleasure to be here with you today. We're going to look at the application of artificial intelligence from the perspective of AR and VR. And I think that when we talk about AI, one of the things that we often reference is structured and unstructured data. Least we forget the 20 terabytes of data on average that are produced within hospitals, and how can we leverage that data? So we'll begin by starting with a wonderful story of two beautiful once conjoined twins, Eva and Erica. And we'll see not only from their experience, but from the experience of others, from both the clinician side as well as the patient side, how this information, if you will, from a medical imaging perspective is being utilized, and how we anticipate as well in the future artificial intelligence being incorporated as a part of it. So there's a lot of technology on the market today. One of the most popular, although not listed here, obviously is the HoloLens technology, but is in fact embedded in many of the technologies. What we're finding is that within both the augmented reality as well as in virtual reality, we're beginning to move into a more mobile application of the technology, which frees up both the clinicians as well as the patients in terms of where they're able to utilize it. Everywhere from mobile devices as well as displays presenting holographic images, as well as the most commonly recognized, which are the headsets. On the display side, what we are being introduced with is a very full interactive capability that allows for clinicians, as an example, to have the opportunity to take what used to be defined as a piece of paper and a pencil, drawing, if you will, models in preparation for surgery, and now converting that to actually looking at the human anatomy in 3D holographic form. Equally so, utilizing the headsets, very full immersive use of technology. Much of the challenge within any practice is all the distractions around us in our environment. Cell phones are a great example of this. And what we're finding, as an example at the University of Illinois and in Chicago, is the application of these devices with residents is actually allowing them to stay focused and be able to deep dive into whatever particular type of cases that they are handling, and not being distracted by things like cell phone usage. So there are many use cases within healthcare, and I've listed some of them up there, but principally the ones that we like to point to are those that are centered around medical education and training, as well as surgical planning and diagnosis. Education and experiences for patients are really big ones, which we'll talk a bit about in a moment, as well as in clinical therapy. And along with this, of course, is a lot of clinical efficacy We have, from across the board, multiple studies that are being conducted as well have already been published. And great examples of where these come together is, as an example, in virtual colonoscopy, where certainly from a patient perspective, it creates for a more pleasing, if you will, experience, as well as creating for higher efficacy, and that the ability to identify flat lesions, as an example, becomes increased with the application of the technology. We also see this in other areas. So if we take, imagine in the upper right-hand corner there, device sizing. So implantable cardiac devices is a great example where we've been able to apply the technology and take what would take, on average, approximately 45 minutes and reducing that down to 5 minutes. Creates for huge implications for both the patients and the clinicians. Think about it from a throughput perspective and being able to manage more cases in a day, having higher levels of efficacy in so much as not only better precision, but as well as less exposure for the patient. These are all huge implications of the technology. This is just the beginning stages. If you think about what we have seen in isolation with the application of the HoloLens, which today sort of gives you data points which one might be able to consider during a surgery, and combining that with the visualization of that information, then we recognize that there's going to be huge additional opportunities. Even so much as today, we're not only doing what we call 3D, but we're actually doing 4D technology, that is haptic response. Being able to take things, as an example, like a navigator, and being able to apply it to surgeries such that we're able to ensure that the surgeon is actually within the appropriate region and positioning for that particular area is very important. And this is where we begin to get glimpses of the application of AI. Another area is in the clinical therapy environment. This is at Providence, a great example of where we've been applying it within the area of trying to manage patients for pain management, giving them an alternative. And what we've been finding is that even with the utilization in the clinical therapy arena, that being able to incorporate the use of information on how the patient is receiving their user acceptance of the technology is very helpful. And so incorporating coaching capability and being able to embed that directly into the system based on biofeedback has been very useful. On the patient education side, as equally, love to point to Mount Sinai. We know that 80% of the information that's provided to patients is forgotten by the time they leave the facility. So there's no wonder that the compliance rates aren't where they need to be. But by applying this type of technology to patient education, we're not only able to create an increased level of retention and comprehension of clinical information by the patient, but we're also able to change their degree of confidence in the surgery. And as you can see in this example, from those patients who were asked to go through neurosurgery, 90% of them were directly affected in positive ways by the technology to the point where they saw a tremendous increase in the number of patients who actually went through with the actual surgery.
You're inside your brain right now,
Right.
inside your skull, I should say,
Wow.
and your brain.
I think I see
Right.
where the aneurysm is.
Oh my goodness.
It was like looking inside my brain. They had told me my aneurysm had bumps on it, and then that aneurysm was more at a potential to burst. And I could actually see that on this screen, which was mind-blowing.
Virtual reality is making its way from the living rooms of video gamers to the workplace. It's being used in more and more industries, everything from crane operators to bankers to athletes. One field where it's really starting to take hold, neurosurgery.
I believe this technology is really transformative in terms of how we operate on patients, in terms of how we engage patients by showing them their own specific detailed anatomy. There you can see the bump on the aneurysm, the blister. Jeanette could see her own brain in 3 dimensions, first on a screen where we can rotate the images, We can explain where we're going to make the hole in her skull, where we're going to approach the aneurysm from what direction, and then she could put on the glasses and see in 3 dimensions, like a video game, in exquisite detail, what her aneurysm looked like, where it was located, what vessels were involved.
The surgery was pretty emotional. My aneurysm was found accidentally, so I'm very fortunate that I had my surgery before the aneurysm had a chance to burst.
So these are great examples of kind of where we are today, but the reality is that we have tremendous opportunity as we start to interject within the medical imaging information other forms of data points that are both influencing the practice, the protocol, if you will, for the clinicians, as well as in terms of the experience for the patients, not only pre but also post-surgery and rehabilitation. And that was certainly a positive outcome for these 2 little conjoined twins who, after the application of the utilization of that technology, had a tremendously positive outcome for themselves, so much so that the clinicians had stated to the family that they had no anticipation after the 17-hour surgery that the children would actually have to come back in the future. So the prognosis was really phenomenal. I want to thank you all for your time. I'm going to hand it over to my colleague. He's going to talk a little bit about robotics.
Hi, my name is Nardo Manaloto. I'm the CEO of Catalyze. Catalyze is a innovation management consulting firm and a virtual startup accelerator. We work with technology startups, corporations, as well as investors, and we bring them all together. So my topic today is about robotic process automation. So that's a pretty simple term to understand. It's robotic, process, and automation. So they're all 3 distinct words that you put together that basically tells you a lot about the technology. So healthcare loves spaghetti, right? So I think we've seen this over and over again in any of our healthcare organization. If anyone have experienced any time and motion studies at all, this is what we do, right? But if you look at what we do, we only measure what people actually do, right? You look at it, but if you look into technologies like robotic process automation, now you're trying to get systems involved in terms of automating processes that people don't have to be involved in. So the whole thing about spaghetti is probably going to untangle, okay? Because these kind of technologies are what is going to solve that. Okay, here's the problem statement. Here's what healthcare is all about. It's very workflow intensive. It's also very manual. We have so much paper-based processes that's kind of going on there, right? And then there's also a lot of human intervention. Think of like one use case, appointment scheduling. It's done over and over again, right? Why are humans kind of doing that? And we also have issues with scarce resources. How many nurses do we graduate? How many PAs do we graduate? How many LVNs and all of that? And so that means it's really hard to scale, hard to change, and just something that's very, very difficult to automate. So I'm going to date myself here. Do you remember this? Anyone seen this screen before? So in this room, who's ever created an Excel macro? Come on, don't lie. Okay, I've created Excel macros. So the whole premise of robotic process automation, think of that concept, right? So it's automating the entire process using software that basically takes over your screen and takes you to an entire workflow. So the prerequisite, so let me show you what RPA is in a glance, right? So it's really computer code, and basically what it does is it enables automation of your graphic user interface, your workflow processes, your data capture, and also your data motion, okay? So what that means is it really mimics kind of the human. So think of how a human does a particular task on, let's say, an Excel spreadsheet or into an EMR. So if you record that particular task all the way through, and created a macro out of that, that's robotic process automation, okay? It's as simple as that. So the history of RPA, it started off with screen scraping. So you basically automate X and Y coordinates. I'm trying to get that data, and I'm trying to put that into some spreadsheet, into some database, so on and so forth. So that's the initial step of RPA. And then we went into like workflow automation. We created workflow engine that has a rules component to it, so on and so forth. Then we graduated into business process integration and management, where you define a particular workflow and you say, oh, this particular node of the workflow reaches out to a particular system, obtains a certain data, puts it into some screen, and then basically have a human look into that data for approval. And then we went into AI. So AI Med is built for that. So we have so many things going on in AI. The promises of AI is still to be seen. There's definitely a lot of work there. But the automation component of it right now is actually much more achievable. So that's where robotic process automation comes in. I think there was a company here that talked about this piece of it, where there's a virtual employee concept. So it's easy to think about it from that perspective, as having a software robot that is a virtual employee that can basically do tasks for you. So that's really what the next generation of automation would be. So here are some examples of use cases. So think of, if you look at an existing chatbot right now, so the chatbot can basically do a conversation. The problem with the conversation is it's great, it can answer a question, but what if you wanted it to do a task, right? So this, if you couple a chatbot with an RPA type system, you could say, hey chatbot, do this for me. And then it'll basically do the task. It'll go, this chatbot or software robot will go into whatever system, collect whatever data, generate rules, trigger rules, and so on and so forth, and provide an actual outcome. So that's a very different scenario from just having a Q&A conversation and having something done for you, okay? So things like, doing prior authorization, doing form filling. We do a lot of surveys, patient satisfaction surveys in healthcare. So there's a lot of these repetitive tasks that are very administrative and waste a lot of time and resources. So some of the RPA benefits, improved data capture. So who here in this audience basically has a really good data capture strategy and says, my data's perfect? Okay, so RPA can help that. So some of the areas where RPA is used is in the area of predictive analytics. So one area that is a big thorn in the side of predictive analytics is the area of missing data. So think of an RPA system that can basically say, you know what, before I do my predictive analytics, I need to complete my data first. I'd like to create robotic processes that would help me obtain data from many different systems until I have a complete data set, okay? No integration needed. So this whole system is actually sitting on top, it's on the top layer of any system that you have. So it's not stuck to any kind of workflow. It's not stuck to any kind of particular hard-based system on the graphical user interface side. It's fully interoperable. It's available 24/7. And I mean, there's a lot of benefits here. And it also creates a human-like interaction, right? So it's mimicking human capability. Okay. So supposedly when you're trying to, the theory of automating work is supposed to be that, right? So you can basically automate some stuff and then you'll have free time. So I did coding myself and I tried to automate a lot of, let's say, file transfer tasks and things like that. And basically it's a very hard thing to do. And it can be mind-blowing there, right? So some of the automation challenges that you get are, do you have clean data? Are you identifying the right processes that you want to automate? If you automate a bad process, it's actually pretty dangerous because it proliferates really badly, right? So think of a scenario where RPA could do harm. So let me give you a scenario. One scenario is I could create a virus that could basically be automated. Okay, so the issue with that is now if you automate that, the proliferation of that virus is actually much worse than what you currently see as a scenario right now. And viruses are really good at proliferate and to multiply. You also need a governance structure for something like this, because the whole premise of this is to ensure that when you automate something, you're not automating something that has an adverse effect to what you're trying to do. Also, some issues with this would be labor union issues. If you're trying to automate something that is done by a nurse or done by a union person, then basically what you're doing is replacing the stuff that they do, and this is something that they're really not comfortable with. So RPA solution components, I'm just naming just a few here. There's a robot user management, because the way this system works is it's a user in the system that has access rights to all these different systems. So think of it as like a virtual employee that can go snooping into your system and doing all these tasks. So you have robot user management. You could define the process of defining the process of the workflow. You have to monitor the process. You also have to look into how you define the graphical user interface interaction. So remember that macro example I told you about? It's about recording the steps towards that. The road to RPA. So you need to have an enterprise automation strategy if you don't have one yet. You need to look into your data lifecycle management, because it's all about data. Knowledge management, okay, is another one. Change management. This thing is basically taking over a lot of your processes, and are you comfortable with that? So these robotic processes can actually make changes and decisions without you knowing it. It's all just running in the background. And of course, lastly, your security policies and procedures need to get looked at among all the other things that's already listed here. Okay, some RPA technology companies. Okay, there's quite a lot here. I've seen only one that's basically done a really good job in healthcare. I won't mention that one. Okay, so future of RPA is really the combination of RPA, AI, and reaching into all these different capabilities here. Okay, so anywhere from mobile phones to databases to devices to smart homes to robotics. So the whole premise is automating all of that process using one piece of software. So some RPA possibilities. What if you combine RPA with Zapier? Or what if you combine RPA with Validic, who has access to all these wearable technologies? Okay? Thank you.
Thank you. I think we're going to go to your questions. And as they appear, maybe we will start with the first one. How does RPA used to improve patient satisfaction?
Yeah, that's actually a really great question. So think of it, if you automate all these menial tasks, let's say from a provider perspective, or for anyone in the clinical staff, then that means they are able to spend more time with the patient, right? So from a satisfaction standpoint, it removes a lot of these repetitive things from tasks and activities that don't need to sit within the physicians or the clinician. That gets in their way, right? So that gets in their way of taking care of patients. So this technology has the ability to actually give productivity back to clinicians and physicians and increase patient satisfaction.
Thank you, Nardo. I think maybe we can use the question number 2 there. Who will be recommending the usage? But let's kind of open it up of VR and as well as RPA and virtual assistants like Molly. So maybe Francis, we will start with you and kind of go around. So how does it get reimbursed, and who is really going to be the sort of crusader and a pioneer within the organizations that is going to be proposing these great technologies?
So I guess I want to first start off with what Nardo was mentioning in relation to the use of RPA. If you think about it, you're thinking about it and giving an example from the clinician's perspective, but we actually just recently, as recent as last week, conducted this focus group amongst older adults. And we were looking at the application of robotic technology in the home setting for clinical purposes and chronic disease management. And one of the first questions that came up was, well, what's going to happen to the people who are taking care of us now? So that's, kind of this is something to kind of think about in terms of, on the one end, it's exciting because it's going to create for benefits and more time, and on others, maybe not. But that time component gets me back to answering the question, and that is that, we really see the opportunity for saving of time and efficacy, and as a result of a combination of those two things means more revenue from the perspective of the facilities themselves and more compliance from the perspective of patients. So challenges that we face today, for example, around readmissions get addressed, and as a result of that, equal to what we've been doing with telehealth services. Think about the codes assigned for telehealth services, and now being able to split those codes into two, so that we have a code for remote patient monitoring. Along with that is going to be the addition and the recognition of these other forms of therapy that come through technology, and hence will ultimately result in reimbursements. And reimbursements means more prescribing of those particular therapies.
How about those, that same process for RPAs? How do you see those being recommended in those organizations?
Yeah, I think, since the RPA is all about automation, and healthcare is really actually bad at automation, I think we could look into how to use these kind of technologies to take care of simple tasks. That's the very first thing, right? So we actually fail in a lot of simple tasks, which means we're increasing resources, we're basically spending a lot, there's a lot of cost into that kind of stuff. So it's easy to actually recommend a technology like this, but there are quite a bit of caution that you need to have with these kinds of technologies, because automating the wrong thing is actually very dangerous. Automating something that's created maliciously is also very dangerous. So, if you automate, let's say, a deletion process in an EMR in an EMR perspective, then that's not a good use of automation. Okay.
I think, collaboration of companies like startups of like ours that actually do automate some of these, repetitive tasks with the RPA process is probably the way forward, as we see Molly that is actually usually sold to caregivers and providers and health plans to automate some of these tasks. But the whole point, and that's what Francis brought up, is really not to eliminate jobs, but to actually free the people that are right now doing double duty. Because how many nurses are actually inputting data into the HRs, answering phones for questions that could be serviced by a virtual assistant? There is really no reason why they need to do it, except there is none present. And so including these new team members into the clinical team and clinical operational team, and making sure that we do it with some forethought so we don't create more problems on the backside is probably the way to go. So let's see what other questions we have here. I actually found that this would be for Fran, and how does HP integrate the different data sources, imaging modalities? I think that is another question that would be really interesting to highlight, because with virtual assistants integrating voice data, with the VR integrating video and VR data, we're going to be needing a lot of space, and we will also have to decide what to keep and where to keep and who owns it. Would you like to tackle that one?
Yeah, I think that's a really valid point. I mean, we look at it and we talk about big data, right, where what we're really talking about is small packets of useful, actionable information and insights. And we do it on two levels within industry. On one end, it's relative to the devices themselves. As an example, we talk about the task of providers, or specifically nurses, the amount of time they're actually interfacing with a system, 3 minutes compared to the 7 minutes it might be with the engagement of the patients themselves. And we use that information to drive towards better improvement in that regard. So, yeah.
Fantastic. Let's see, we have one thing that I actually do want to comment on, and that is that Molly provided a flawed medical information. So first of all, we all love really a little demo, and the whole point of it is to kind of see the interaction and the emotional charge that an avatar can have. But I think that actually it brings up a question and an issue that we have to really think about when we look at virtual assistants transitioning from doing these repetitive tasks to actually starting to embark on a clinical triage space where they are either replacing or simulating what humans are already doing. And that is something that we have tackled with NHS, with the Ask NHS application. And there is no system that is perfect, but I think the first step is we really have Molly or Olivia actually read the same information that a health advisor would on the phone, because the telephony line is very simple. It is a very simply trained individual sitting in front of the computer reading the same script that Molly is reading. And so these applications initially are only as good as we make them, and they cannot be made without a collaboration of clinicians, technologists, and strategists. And so maybe you can share with me sort of your views on how do we kind of transition these technologies and involve the community, clinical, technical, business, and financial, so we can create and move it forward even into spaces where it is controversial.
Yeah, well, I think first of all, we also need to get grounded on the truth of misdiagnosis as well, right? So, I mean, humans are flawed. There's a lot of errors that happen within healthcare, so we need to look at that as a base. And then what you want to do is also be proud of the knowledge of what humans have done and say, what have trained these technologies are actually human knowledge, right? And what you want to do is create that transition and bridge that divide between it's almost like augmenting AI and AI augmenting humans. It needs to be that kind of a relationship as a way to build trust with each other, right? Because at the end of it, we're better. We're actually much better if we're two heads better than one, right?
So I visited with a facility and it was talking on virtual reality, and one of the things that came up and at the end of the presentation was, we have a strategic committee and we're looking at our 2020 plan. And I thought, well, if you're going to wait till 2020, you're going to always be playing catch up. So we started to talk about a crawl, walk, run strategy, and look at those things which are really predictable. Going back to your comment about what do we know that we're doing really well, acknowledge that, and in terms of the predictability, that is that 100%, when we know 100% of the time that it's going to be performed this way, and that the outcomes from that, there's no negative possibility occur, right? There's no type 1 or type 2 error that's going to result from the performance of this particular task. Identify those and leverage those as an opportunity to interject the technology. The other is to look at where it most complements your workflow today. Because that's where there tends to be the biggest amount of rub. So when you're looking at robotics, if you're looking at virtual assistants, if you're looking at virtual reality, looking at those areas where it's really easy to integrate. As an example, education is a simple place to begin. Protocols around that, standardizations around that are pretty simplistic, and as a result makes it easy to integrate. And then moving and progressing along that path as you build more confidence, more learnings, more best practices to look at more complex areas, like looking at applications for surgical protocol modification, which requires you to make some adjustments, significant adjustments to workflows, and where potentially the risk might be greater.
Fantastic. I think maybe we can close with a few words from both of you, and then I will start as what is it that you're looking forward to for the next year to come. And then I think in the virtual assistant space, what I'm really hoping and looking forward to, that we will be able to create more integration with the EHR records to actually augment some of the data to bring in to make Molly smarter and actually understand better where she belongs. How about yourself?
Yeah, I think for me, it's really the cooperation of human and AI from augmenting each other and improving each other.
Convergence, bring it all together, really. I think I agree with you. It's the same.
I think that's
Yeah.
probably a good way to
Yeah.
end. Thank you. Thank you both.